Okay, so here we are. This is such a treat, and I'm so glad that we finally got together on this. You're my second guest, and so this is my chance to introduce you to everyone and tell everyone how much you mean to me.
Oh.
So thanks, Rebecca, for being here. Rebecca Murray is one of my favorite people, favorite clients that I've met. I think it was probably, I don't know, I want to say like 6 or 7 years ago.
Mm-hmm. Yeah.
And we did a little filming together.
Yes, we did.
I
I had a video company back then.
Yes.
Yeah.
Yeah, and your company, Showcase Your Shine. Showcase Your Shine is something that is extremely valuable. Has been really valuable to me as a speaker because it's so important as a dentist to be able to communicate to your clients. So I've learned so much from you. Thank you for being here, and this is such an important moment for me. And so I want to start by saying, thanks for taking the time. It's Friday, and we're here to talk about all different topics: communication, your professional company, helping professionals speak, and helping teams collaborate better. What is more valuable than that right now? I think that is such a force multiplier for my team. I want to have you to Perry University, and we can talk about that as well. But anyway, thank you. And, the first thing I'd like to talk about, if you don't mind, is just what I've learned from you and over the years. So there is another dentist that talks about communication. Retired from dentistry early because of an injury. His name is Paul Homily. He's meant a lot to me in the communication space. Basically, his position is, and he's right, that dentist to patient communication is broken, usually because dentists are trying to get too technical and not really highlighting the benefits of dentistry from a patient perspective. For example, instead of talking about a crown, a veneer, or how it works, we should be talking about how it's going to change your life in terms of your smiling with confidence, or chewing tasty, crunchy foods, which everyone loves. That's like the best part of life. Especially, as you get older, what's for breakfast, what's for lunch, it makes everything more enjoyable, at mealtime when you can be able to use your teeth to function.
Yes, with confidence.
Yeah, with confidence. And so Paul Homily has meant so much to me. I just really want to give him a lot of credit too, because he's been a great influence. He's still active in Arizona. He's in Phoenix. So I really enjoy him. And you're also my local Paul Homily, and a local celebrity. Yeah, that I've had so much of a good time with you together, and I've watched your brand, and I love your graphics as well.
You.
I love the book that you wrote, and it's wonderful. I want to talk about that as well.
Okay, that's great.
So I remember so much of I think photography. You helped with a composite photo of all our team, which we treasure that photo, and the Showcase Your Shine is something that I'm going to integrate into our team culture and in our team to make us more effective to each other. Make us kinder to each other, and I think that's going to really help us get along better. And then also, I'd like to learn a lot more from your program as we can relate to patients better too. Yeah. Because really, I don't see selling dentistry as really difficult if we can find out what people want, because we can help people on all different levels.
Yes.
It just depends on how much time we spend. And so being able to communicate effectively and more get right to it, basically.
Yes. Yeah. And you do such a beautiful job at that.
Oh, well, thanks. I mean, I probably because I know it's important, and so I've been really working on it.
Yes.
I haven't always been the best communicator. I mean, I remember in undergraduate college, I was a chemistry TA. So I was teaching undergraduate students inorganic chemistry. I would have my own lecture on Thursdays. The professor would have lectures every weekday, and then I would summarize and kind of help the students. But what I found out was it wasn't working very well for me, okay? And so...
what do you mean by wasn't working very well?
Well, I couldn't change the way they were absorbing the information.
Mm-hmm.
And maybe I'm not giving myself enough credit because it ended making one or two of the nursing students cry, basically. So
okay.
I think what I said was basically, there's no other way I can explain it. Like this is you just have to understand this.
Oh, I see. Okay,
So
you have to understand it the way I'm communicating it to you, and if you don't, that's your problem.
Kind of, yeah.
Yeah.
You're exactly something like that. I would say I said, hey, if you don't understand it this way, that you just, A plus B equals C,
Yes.
There's no other way of saying it. Yeah.
How did you feel when she was crying?
And I think that was too difficult, too coarse, not kind enough,
yes,
apparently,
right.
obviously.
Lacking empathy a little bit.
Exactly,
Yeah.
yep. And so my boss at the time, which was the coordinator, said to me, I think we're just going to, move you to somewhere else.
I see.
A different role. So...
And did you get that at the time? You understood the reason why? They explained it to you? Maybe you need to learn some interpersonal skills first before coming into this role. It's probably a good thing for them to understand too, because sounds like maybe they didn't support you in enhancing your interpersonal communication skills either.
Well, part of it was young. I was young.
Yes, yes.
And part of it was they just need to make a change, because obviously you don't want to upset other students because this guy is a jerk.
Right.
So
you're making people cry.
The conclusion I came to was that I'm not a good communicator.
I see. Yes, right.
See what I mean?
That belief that you had. Yes.
Right. I formed a belief that I'm not a great communicator.
Mm-hmm.
This isn't my forte. Mm-hmm. This isn't my thing. I should not be doing, I don't consider myself a good communicator.
Wow.
And I also struggled with speech class.
Mm-hmm.
There was a speech course in college that, it's a 100 level course. I had difficulty with that. And also reinforced the belief that I wasn't a great communicator.
Yes, of course. Yes. And most people in that class struggle with it.
Mm-hmm.
Probably a minority did not. Those who maybe had a theater background or in front of audiences with their musical instruments since they were kids, probably had an easier time perhaps with being in front of people and having all eyes on them.
Right.
But I bet you 90% of that class felt exactly like you did.
Yeah, and it was at the time the book was Imagine Your Audience Naked or something like that.
Oh,
yes. Do you remember that book?
Yeah, terrible advice, right.
Yeah, which I didn't understand how that would resonate with anyone. That's hard to do, to imagine that.
And horrifying, really, when you think of it.
Yeah, but that was really showcased at that course. That was like the primary.
Yes.
So we were trying to do that in this course. This is like in the late 90s.
Yes, I remember hearing that once upon a time as well. And I thought, nope, I'm not doing that.
Yeah. But I remember that, and I didn't do well in that class. And so it reinforced this idea that I'm not a great communicator. So over the years, I thought, like, I really need to focus on this,
Yeah.
And the difference between, I wanted to reach my potential as a speaker. So that's why I really enjoyed meeting you and finding out like your skills, and thought, ooh, this is somebody that, I can really learn from.
Yeah. Well, when I first met you, do you remember me telling you?
Mm-mm.
I consider you the dentist to the stars.
Oh, cool.
You're like the Dr. Oz, on Oprah.
That's great.
You belong in Hollywood. you are, in my mind, you are the dentist to the stars. I mean, you have the communication skills. I've always felt supported and educated by you.
Great.
Like the way you explain things in this non-pressure way and help me understand my choices, what's going on in my mouth so that I can make choices for myself.
Nice.
With confidence. That's why I love you.
Thank you.
And your whole staff. I mean, just the experience here, and we'll talk about my 4Crown experience, my spa experience. But I wanted to go back to that time when you were in dentistry, or in school.
Yep.
Because you were also in the military.
Right.
At that same time.
Right.
Right. And the Air Force.
Correct.
The Air Force, yeah. So there's a picture in the office here of you in front of a fighter jet in your flight uniform. Looks so much like Tom Cruise. I mean, that's who you remind me of. We were talking about that this morning, how much, plastic surgery that Tom Cruise has had. Tom Cruise and I are the same age. And that you, like you're a younger version of Tom Cruise who doesn't dye his hair and looks amazing with silver hair. I mean, you really have that Hollywood look about you. But when people see that, and so could you tell the story of how you were sort of deciding between careers, which career you would go? Yeah,
so I was a private pilot, learned to fly during dental school. There's a window where you need to get into pilot training before 26 and a half years old. Oh. It might be 27 years old now. So I needed to decide if I want to pursue this dream of fighter aviation. And so I decided to go for it. I finished dental school, became board certified, and then got my license to practice dentistry before going off to Air Force pilot training. So it's a little bit different. I mean, most of the dentist pilots that I knew were Vietnam vets that came back from war, and then they went to dental school. So that a long time ago, they were pilots. My goal was to be a pilot 1 day a week, and then be a dentist 3 days a week, or 4 days a week. So do it concurrently. What I hadn't figured out is that just the intensity of both careers. Especially fighter pilots' task limit had to go from level 8 to like level 10 or level 11. So I basically learned my Peter principle, which is you get promoted to a level of incompetence.
Right.
Right? And then you go down one level, and that's where you stay in the professional world. That's called the Peter principle.
Right.
And so I had to go and just kind of find my level of incompetence. And so I was in a room full of cadets competing with students. I was a little bit older because I was already a graduate of dental school.
So it was like the Tom Cruise scenario in that movie.
Yeah, just
right?
like that. Just like that.
Yeah.
Yep. And then the room became a little bit smarter, and better looking and stronger and maybe a little bit sharper, both in language and in mental acuity. And the speed just kept going. It would be like similar to like chess, there'd be like chess students in high school.
Yeah.
And then college, and then graduate school, and then the world champion chess players.
Right.
And they're not as nice as the high school chess coach,
Right. Very competitive.
Yeah. And so I got to go through that. And I think that really shaped me, on a professional level. But, I also need to smooth out those rough edges, through communication, because I can be short or just my body language. I would say that if I were to focus on my weaknesses, they would be like softening my body language when I'm frustrated or tired or hungry, you know. So, yeah, and that is probably because I'm thinking about 6 different things.
Yeah,
you know?
exactly.
Yeah, and so I've learned that I'm really good one-on-one.
You are.
I'm probably an introvert because
yes, you are.
Right? I mean,
Yes,
the
you
definition of introvert versus extrovert, I think, has changed for me over the time. My understanding of it was I used to think that it was introvert doesn't like people at all.
Yeah, yes,
but
right.
I think that that's not true. That introvert is really good one-on-one. An extrovert feels more comfortable with a group of 20 or more people. They love to have big groups.
Yeah.
An introvert enjoys more one-on-one. So, and I think our culture encourages everyone to become an extrovert, right? And so introverts are not encouraged perhaps in school, like maybe they should be, but my definition of introvert and extrovert has kind of like changed a little bit. Right?
Well, your chair-side manner, I guess that's what we would call it in dentistry versus bedside manner, is incredible.
Thank you.
Your eye contact, you're calm, you add some humor, and the way you describe things. For example, last time I was in, we were talking about recession. I was asking you, why is it that my gums keep receding? Like it's driving me crazy, and I'm worried that when I get to 80 that my teeth are going to look like skeleton teeth or they're going to fall out or something like that, you know? And you said, have you ever heard that phrase, long in the tooth?
Right.
Yes. And then you just looked at me and I'm like, oh, that's where that came from, right? These people back in, let's say, England without dental care, and as you get older, your teeth get longer because your gums get shorter.
Right.
And since you're sharing that with me, I've shared that with so many people. You know that phrase, long in the tooth? You know where that came from? My dentist told me.
Yeah.
You know, and everybody's like, oh, I never knew that. That makes total sense. So you make me smarter.
Thanks. Yeah. That's a great phrase. It kind of describes what's going on for some people. And, you know, it's going to happen at different levels for different people. You know, like there's going to be a little bit of bone loss over the years. And then the gingival margin, the gum level, they say it changes about 1 millimeter per decade. Okay. And that's a general rule of thumb. 1 millimeter
sounds like a lot.
Yeah. So,
oh my goodness.
Yeah.
That's scary.
Yeah. And you know, it could be a 0.5 millimeter per decade for some people, or near 0 for other people.
Okay. So let's talk about that, because I know, you know, many people probably wonder about this, like as they age. I'm 64. What's happening in my mouth? Like, I don't want to have a smile that looks like where people go, oh, she's long in the tooth. Yeah, right. You know, so what can I
do, right?
Yeah, what can I do to slow this down or prevent it?
So it's multifactorial, meaning there are probably 3 or 4 different factors to control or to consider. One is pressure. Biting, pressure, clenching, grinding. These are all habits that you want to control. Just the big one, clenching or grinding, can be controlled if your brain is happy with how your teeth touch. If there's an interference, or if your teeth are jammed a little bit, which can happen, it can really happen with dentistry. You know, if you get a filling or a crown, it can really throw your bite off a little bit.
Oh, I see.
So you just want to make sure that you have that you've checked that perfectly, and that there's no interference, because the main cause of clenching is an adaptive response. So human adaptive response. Pretty normal. Normal people, almost everyone would have a normal adaptive response to an interference by clenching. So the brain's just trying to figure it out.
I see.
So it's 99% of clenching and grinding is there. It is rare to have a condition where even if you have no interferences, you have a perfect bite, this person can't stop clenching or grinding. But that's very unusual.
Okay.
Very unusual. So that's number one, is just make sure that the pressure's on your teeth, because teeth are held into your skull with a ligament, so that ligament can get, if it's stretched and pulled too much, it can cause bone loss just from pressure.
Okay.
Not even considering the other things, like what is the inflammatory relationship between your oral environment and your body, because the teeth are the only place in your body where there's something sticking out of your skin.
Yeah,
like horns or antlers.
Never thought of it that way.
Yeah, and right on the edge of something sticking out of your skin. It's the only place in the body.
Wow.
Your body has a great way of dealing with that edge there, on that gingival edge, without getting too far in the weeds with the technical stuff. There is really a fantastic, astonishing way that your body has positive and negative electronic charge. Okay, so this polarity of positive and negative can repel bacteria at that edge, at that level. So what this means is, like, some people don't have that very well, and some habits can disrupt that. So, one in particular is smoking. That we can see that from a mile away, and you really see it have an effect because of that. Because of that relationship, it kind of turns that off. So there's
people
a lot
that
of bone
smoke
loss.
have more gum recession.
Yes, definitely.
Wow.
Yeah.
And what other habits besides grinding, misaligned bite and smoking? What else?
Well, I mean, some people are out of shape. Their gum tissue is out of shape. I would say that they need to have it exercised more often.
Like how do we do that? How do we exercise that?
There's all kinds of physical stimulation, like water pick, toothpick.
Oh, really?
Flossing.
Does flossing does that same thing?
Yep, and you have to do it often.
Okay. And so how often is it best to floss after every single meal?
There is no problem flossing at every single meal. I mean, people seem to think that that's bad, or that they shouldn't have to do that. But there's no problem with that. No problem at all. And it actually is quite healthy to do that. So plaque is a bacterial biofilm that's develops after only 12 hours.
12 hours?
Yep. So it's that film that you can feel on your teeth after you haven't brushed for a day or something like that.
Yeah. I mean, not now because I just brushed this morning.
Yeah. So camping trip, maybe you miss brushing and you kind of feel your teeth kind of feel fuzzy.
Right.
That's plaque.
Okay.
And that for sure has to be physically removed. And if you do that and you're exercising your gum tissue, I mean, I think we should all see it as exercise.
Yeah, that's a great way to look at it. So if your gums are out of shape, that you can get them back into shape.
Right, yeah.
By starting this exercise program, basically.
Exactly. If you just have an exercise program, like, you get up in the morning and do push-ups or squats and it's very similar to that. If you have a healthy routine that includes physical stimulation of your gum tissue and removal of the plaque, that can prevent any inflammation right at the edge between the skin and the bone.
Yes.
The bones that are sticking out of your teeth, you could say.
Yeah, right. So what would be, a reasonable for people who don't want to floss 3 times a day and maybe don't even floss now, maybe think about it once a month. What's a way to ease into it? It's sort of like getting a gym membership where, you haven't been at the gym for 2 years and you decide, this is the year I'm getting in shape. And it's hard to start. It's hard to start. So what's a good way to get started for somebody whose gums are out of shape?
So I recommend these flossers that are already wound.
Oh, okay. Like the little plastic things with that my husband uses those. Thanks to you, actually.
Okay, great.
Yeah.
That's wonderful. Thank you.
Yes.
So one of the things I like to tell people is don't throw them away.
Oh, okay. That's great. Because I think about the landfill every time one of those goes in the garbage. Okay, so don't throw them away. Yeah,
and I love surfing. I don't want them showing up on a beach somewhere, like floating through the ocean.
Yes, because they're made of plastic.
So reuse those.
Okay,
which is an enormous help for the environment, right?
Yes.
The reuse part, I think, is like the difficult thing with recycled materials, that if they're not high quality, then the fabric or the fiber can shred, and then it's useless. And then so a flosser that's made out of bamboo with a charcoal fiber that tears the first time you use it.
Right. Yes.
Okay. What good is that?
Exactly.
And so that's now probably worse for the environment.
Yes.
But if you have a really high quality fiber that would last, sometimes these flossers will last 6 months to a year.
Just one?
Yeah, of course. Yeah, if you take care of it and you have smooth contacts.
Yes. Oh my gosh. I'm so happy to hear you say this, because now I can tell my husband. It bothers me. He would use one every night. I think like a lot of people do, because they come in a package of 100.
Yeah, exactly.
I mean, there's so many of them in the package. It gives you the impression that they are one use only.
It does. Yeah, you're right. There's a big misconception about that. I would see it like you see a toothbrush. I mean, we reuse our toothbrush, right? We don't throw away our toothbrush after one use.
Yes.
And neither should we do that to these little flossers.
So happy to hear you say that.
Hey guys, thanks for watching the Blake Perry podcast. Please tune in next week, because we're going to continue the conversation with Rebecca.